I'm pleased to be back here with Dr Barbara Kubicka, founder of Clinicbe, and you're in this looking good, feeling good business here of aesthetic medicine. I just wanted to ask you a little bit about when somebody decides that they're going to have some procedures done or they're wanting to look better. Presumably there's a big decision around who they pick or which clinic they go to. I wonder if you could just shed some light on how do you even begin that process? How do you select the person? How do you select the clinic?
I'm glad that you asked this question because I think that's the most important decision, to choose the place that it's suitable for a particular person. And nowadays there are so many different clinics and so many different ways of improving one appearance or health that it's important to be discerning in terms of the choice. Recommendation is always a good decision, the good starting point.
So that's somebody you know, if anybody you know has been through the process.
And you see the results, see the outcome, it's quite a good indication of what's going to happen for you. But even though that's the first reason of choosing the place, it's very important to do own research, to have a look on the background of the clinic, to find out about qualifications of the doctor as a staff, see as well what products they use, whether they have a good quality products that they work on or they don't put so much emphasis on that. There are bodies that regulates now the aesthetic medicine. Unfortunately, there's more and more clearance in that place, and things like CQC, for example, indicates that the clinic is of the medical nature rather than the beauty salon. Another things that would be interesting of having in mind when going through the process, it's how this place makes us feel.
So that's the personal side. So you talked about the technical things, are they qualified and so on, what were the results like from those personal recommendations, but then do you feel good presumably when you walk through the door, when you have a conversation with them?
Absolutely, and I think that that's a crucial part because when you have we have our information in place, then we still have a little bit of room to make a decision. And that should be based on how we feel when we enter the clinic, how we feel with the doctor or the nurse performing the treatment. And it's very important not to feel under pressure, to feel understood, to feel that person really cares about our needs. So all of this have to be in place to have the best results.
Right, and so as you say that, I'm thinking that presumably, particularly if somebody's starting, that you shouldn't feel under pressure. You should feel that everything's at your own pace and that you feel comfortable. And that might even be somebody perhaps saying, no, it's not for you or what have you. Is that part of it?
Yeah, absolutely. I think that's a big part, and it's big responsibility of medical staff, of medical professionals to be able to advise. So it's not about only offering the treatment, it's advice for our patients. So yes, saying what is good, what is bad, what we can offer, but as well saying knowing where to say no, and sometimes discuss other options as well.
I just wanted to close by asking you a little bit about, for you and your clinic, what's most important to you about the whole experience, about when somebody's coming through the door or when they're selecting, because I get the feeling it's something you're personally passionate about.
You're right, I'm very passionate about this, and for me the most important is for patients to feel comfortable and confident in that place where they know that they are understood, and we don't suggest what they should do and it comes from them, but in the same time they feel looked after and cared. So giving the balance to the information, but as well the very bespoke service.
Oh, that's so useful. Thank you so much, Dr Barbara.